You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, the deep plane facelift. If you're considering any type of facial rejuvenation, facial surgery, you have to hear what board-certified plastic surgeon Dr. Paul Chasan has to say. Dr. Chasan, welcome back to the program.
All right, Randy. Hi.
Now, I had you on the program like 18 years ago.
Yep. And
I think you look younger now, by the way. I'm right here close up.
Thanks.
And you look good. You're taking care of yourself. But what's changed with facelifting?
Okay, so...
A lot?
Yeah. Facelifting has gone through a huge evolution. And I'll just start with the basic. Around the 70s and 80s, people were just doing skin-only facelifts. And the problem is the skin as an organ keeps the environment out, but it stretches with time, okay? So if you put a stretch on the skin, that's why we can have babies. You put stretch on the skin, it's gonna get lax. So after, people were doing facelifts and in the 70s, they just were getting, results that last 6-8 months, and then, a lot of that skin would start stretching out. So, a few guys were starting to experiment with the deeper structures, and there's a fibrofatty covering over the muscles called the SMAS layer. And so in the 70s and 80s, there was a couple guys working on that and pulling that SMAS layer, and they found that wouldn't stretch as much as the skin. And so that was the birth of the, quote, SMAS facelift. And the SMAS facelift lasted for decades. The problem with the SMAS facelift is that you're pulling from this part of the face, and the part here was not getting quite the pull. And so it was very difficult to efface or get rid of the nasolabial fold, the wrinkling here. And so you could get great results, but and remember, there's some people who just have neck and they don't have much face, and the neck does great on everybody. Because remember, when you talk about facelifting, it's really a neck lift and then a lower facelift, okay? And then, I was noticing, still this part was improved in some people. And so...
So just so I could follow this.
Yeah.
So you're talking about the neck was easy, but that this little part right here, like the nasolabial folds, wasn't being addressed very well.
And so in the early 2000s, in late 1990s, there was the mid-facelift. And I was doing mid-facelifting, but the problem is I would do it, and it's a big surgery and a lot of recovery, and 6 months later, it would drop down. I was like, and so a lot of my colleagues started noticing that same thing.
Okay.
And so then we started noticing the early 2000s, fat grafting kind of started. And the fat grafting revolutionized the facelift industry. So we were getting pretty good facelifts with the SMAS, and then fat grafting here, jawline, lower eyelids, upper eyelids, temples. So a lot of women have this temple hollowing. And so adding the fat really helped a lot. And so that made kind of the facelift a real deal. And so if you see your friend had a facelift and now she looks great, and she looks 6 months later, she looks great, and a year later she looks great, then you're going to get a facelift. So facelifting took off, okay? But still, that facelifting technique suffered a little bit of just basically you couldn't really pull on this stuff enough, And if you tried, then you got that windblown look that didn't look so good. So let me just show you kind of a random, standard, mini facelift. And so, we start seeing what I was telling you in the green room was, women, Botox, fillers, they work great until, I hear this all the time, late 40s, early 50s. I've been using fillers and Botox, it's just not working like it used to, okay? So when somebody comes in like that, this lady was in her 60s, and we just did, a lower mini facelift, and you can see look how much more youthful, and she looks great, okay?
So what defines a mini facelift? So you're just addressing the neck and jowls?
Okay, so the difference between a mini facelift and a facelift, it's a play on words. Mini face, everybody wants a mini facelift, right? Okay. So what you do with a mini facelift is the same as a facelift on the sides. Same incisions, undermine, but you don't open up the neck. You don't open up the neck. So if somebody has a thick neck or big bands, then you open up the neck. Okay. So I'm going to kind of take you stepwise from mini to extended mini to a facelift. Okay. So I think for the audience,
interesting. Yeah.
They want to hear this stuff, right? So this would be an extended mini. I showed her before in the rhinoplasty section, but this one is a full facial rejuvenation. So when you say full facelift, that's talking brows, upper lids, lower lids. I did her nose, and fat grafting. So in her case, you see where the nasolabial folds, these guys, okay? The marionette lines, the jowl, okay? So in someone like that, the fat grafting really helped. So I did an extended mini. In other words, I didn't open up her neck, but I did liposuction under here, did a very extensive mini, and then I fat grafted all those areas. So you can see how the jowls have improved and the nasolabial folds.
She looks years
younger.
Like at least 10 years younger.
Easy, and more pretty, right?
She's prettier.
She's much
And you did her
prettier.
nose as well.
Yes. And some people, that's what they need. So mini lift, then you'd have this extended mini with fat grafting, and the fat grafting really has helped a lot. And now you have this lady, she's 78 years old. And the issue now, today, if you notice her nasolabial folds, okay, that area, it's very difficult to improve in just doing a facelift. We did a deep plane facelift on her. So what does that mean?
Yeah, what does that mean?
Okay, so a deep plane facelift is, and you're gonna have to look at me,
okay,
because I can give you a drawing or whatever, but basically with the old SMAS facelifts, you're cutting here, undermining, and pulling, but your pull is from here to here, and it loses some in translation. The deep plane, not only are you going more to the front, but you're undermining, there's a bunch of ligaments here, and you're undermining all those ligaments all the way to here. So when you pull, it just, the whole face moves out. Now, you have to be a pro at facelifts to do a deep plane. You can't just show up one day and say, hey, I'm going to be a deep plane facelift surgeon. Okay. You have to know the anatomy.
Because that word's being thrown around everywhere.
Yeah.
Deep
because
plane.
it works. It works beautifully. Now, do I do a deep plane on everybody? No, because if they don't have big nasolabial folds, if the central third of their face isn't loose, there's no need.
Are you repositioning tissues up and back?
Yes, but more up than back.
So like repositioning tissues to where they used to be.
Yes. But
so
the thing
on those nasolabial folds, just this part right here, instead of just putting fillers, you lifted what was above it, and they go away.
So in this lady, when you remove or release there's these ligaments that live right in here, and the traditional techniques, you're not really addressing those ligaments. And those ligaments, even if you pull, prevent this from getting moving. And the idea is once you've released those ligaments, you're not having to pull very hard. And that's the key, is that everything just moves like this. It's like pulling. When you're a young plastic surgeon and you're not very talented, you don't know how hard to pull, you're always pulling really tight. And that's a mistake. As I've matured as a plastic surgeon, I found that it's easy to take off all this fat here, but nowadays I leave as much fat on the neck as I can to give it a youthful neck. I'm doing much more releasing and not pulling so hard. One of the things also that I do...
When you say releasing, like detaching?
Detaching the ligaments, there's like these
so
tight
the face is easier
bands.
To move up?
Yeah.
Okay.
So if you have a band, let's see, if you have a band here and you're pulling, it's nothing happens. But if you release it, you can move that way.
Okay.
And so the other thing is contouring. Like the neck, instead of pulling, if you're on the table and you pull, it looks good on the table, but you have to understand, the body doesn't like getting pulled, okay? And so recontouring is really important. So now when I'm doing a neck, I'm like, you can see her neck bands, right?
Yes.
So that's a whole different aspect so on someone who has neck bands, I would just, pull to the side, but then you find that you get recurrent neck bands because over time, that repair that you suture those muscles in the center, you pull, and over time, 6 months, they pull away. So I finally, I do neck recontouring. So neck recontouring is sometimes people have these submandibular glands. Some people have digastric muscles here. And so if I trim off a little of the digastric and move a portion, maybe sometimes this big, that's a huge lump in your neck. And when we remove some of the fat, then you see that lump. And so consequently, removing submandibular glands, partial digastric, subplatysmal fat, and then when I suture the platysma muscle, these this
Yeah.
muscle. See, I have a band. when you remove, I suture that what we call pants over vest. I'm suturing this to this and this to this. So now I have all this connection here, and then I'm suturing it down to the deeper tissues. So now if I have any kind of pull laterally, these things don't stretch out. So all these little techniques you put together, and then you have a really balanced result, but more importantly, a result with longevity. So longevity in facelifting is huge.
You said sometimes they feel younger. I mean, what's all done, they not only look younger, but they feel younger.
Yes.
Elaborate on that.
Well, I'll tell you.
What's happening there?
Well, I have, there's no question that when you look younger and you like taking pictures and people respond to you differently. For sure, people respond to you differently. Many years ago, I had a hair transplant. I could totally tell how people responded to me. It felt great. It was great for my confidence. It's the same kind of thing. That feeling of confidence is awesome. And when you feel that way, you project
now, has
differently.
this Ozempic face, or people using these GLP-1 to lose all of the weight,
right?
They're getting saggier. Are you seeing a lot of that now?
I want to address that because Ozempic face is a term, right? Yeah. It's a term, and it's kind of almost derogatory term. Where I want to make sure that everybody knows that the benefits of GLP-1s, Ozempic, Mounjaro, Zepbound are so radically good and changed my world so much that if you lose weight, you're going to sometimes have more jowling or neck. But
or hollow.
Yeah, or hollow. So yes, that occurs. But it's been revolutionary in my world, especially in the perimenopausal and postmenopausal women.
How so? What do you mean?
Well, doing it 30 years, right? I kind of know this business. And, I find that women in that perimenopausal area, 45, 50, I'm working out, I'm dieting, I'm exercising, I'm doing all the right things. I've gained 15, 20 pounds, and it just doesn't come off no matter what. And if they lose 5 pounds, they gain it right back. It's very frustrating. It's frustrating for them. And all I can offer is maybe I can do some lipo, but liposuction is not a cure for weight loss. It's removing areas, right? It's not to, make you skinnier. I had a patient I did a mommy makeover on, and you know what? She had a great result, but then she lost like 25 pounds on Ozempic, and her results went from great to like, boo, sky, unbelievable. I mean, it did, tummy
the body
tuck.
looks younger when it's thinner.
Oh, the way the skin reflected light, everything about it. And, people always wonder, hey, if I do a mommy makeover, lose 20 pounds, is that going to ruin it? No. It makes it better. And so, the fact that she's, when you lose weight and you feel better, well, you just want to keep that up. You start exercising more and all that. So that was like my first test case. Okay. And then, I started noticing, we started using it on patients. And
Is that right?
I've seen, we have a physician assistant at my office that prescribes it for people. And we do it as a service. We don't make any money on it. We do it as a service. But the results have been revolutionary in my practice. And especially that perimenopausal group where I had to offer
So these mommy makeover crowd that you're doing.
Oh, every one of them, it's incredible. It's average 30-pound weight loss. People who were just like always kind of overweight look like supermodels. I mean, it's incredible. Guys are doing it now, and it has revolutionized my practice. In fact, people who come in, oftentimes they come in for body contouring. No. We're not doing surgery. You're going on GLP-1 for 4 months. Then come back, then we'll talk. Because, this is something that has changed everything.
Okay, so back to the faces. So you're combining that, so now they're in good shape, they're eating better, they're exercising, and then they look in the mirror and they look younger.
Yes.
So let's take a look at some more of these photos.
Yeah. So, back to facelifts.
Okay.
It's just such a cool thing that's changed a lot.
Yeah.
So here's a lady, she's 73 years old in this picture. And you know what? You were talking about like,
She's 73?
Do they feel younger well, she's a Pilates instructor.
Okay.
Every day. She's super cool, super young thinker. And, 73 with some jowls. And she just wanted to look a little better, right? She feels young. She didn't feel like she looked young.
Is that a deep plane in her case?
In her case, I did not do a deep plane. This is probably, I'm going to say, 2.5, about 3 years old result. So, and she didn't really need a deep plane. You know, she didn't
So
really
it all
have.
comes down to judgment. It's not like everybody
Totally.
needs a deep plane. 'Cause
Not-
my impression was deep plane is just the way to go because you're going deeper.
No, see, so the
Okay.
deep plane is it's wonderful, and for the right person, it's wonderful. But you do more dissection. There's a little more recovery, you know, and you add a little bit of risk to that.
Okay.
I think that your surgeon should be well versed in fat transfer. I do fat transfer in almost every facelift. Deep plane in most, but not all. You can get a wonderful result without deep plane, but you can also get wonderful results.
I mean, that's the
with
youngest
it.
looking 73-year-old in
And
town.
you know, also submandibular gland excision. A lot of surgeons, I would say, in this city, probably no more than a dozen do submandibular gland excisions on a regular basis because they're scared of it. There's, you know, it's
I don't know what that means.
okay. So you have a gland right here, and it's a bulky gland right here. And some people have them and some people don't. Or they all have them, but some droop down and they become a bulge here. And it kind of ruins the effect of doing a facelift. You can do a facelift, but you can't get your best result.
So you address that.
I addressed that. And I was the first one in San Diego to do submandibular gland excision. I went to the guru of submandibular gland excisions and learned that like 12 years ago. And then I brought it back to my surgical center, and everybody who works out of my surgical center, I taught how to do that because it's such an integral part of facelifting surgery. You shouldn't be doing facelift
And it helps
surgery.
thin the neck as
Yeah,
well.
it gives a better contour. Does everybody need it? No, probably 1 out of 5 facelifts, 1 out of 4 facelifts do it. But it's so fun for me because I do my walk around, you know, I'll be in clinic and I'll do my walk around, somebody's doing a facelift and you know, and I see the 2 submandibular glands, they're laying there and he goes, yeah, it's great. And I taught him how to do that, right? So it's really pretty cool and it really makes a big difference. For example, you know, we were talking about rhinoplasties and we're talking about male rhinoplasties, but what's become more popular is male facelifting, okay?
Seems like a scary thing to do.
No, but I mean, look, men, a different paradigm. You don't want to be a perfect looking guy. Like a woman, you could take away every wrinkle, make them look perfect, they look great. You make a guy look like that, they look weird. That's the guy that gets in the elevator and you look at him like, oh, you look weird. You know what I mean? So you have to have a different judgment. So men should have facelifting later in life. It's okay for a man to have a little, what I call craggle, a little bit of irregular, looks good on a man. Too perfect, doesn't look good. But we're talking about submandibular gland excisions, okay? So this is exactly the neck where I did a submandibular gland excision and did recontouring the neck. This isn't pulling, this is recontouring. So here you go. And you can see how nice of a transformation that is. Look, I mean, look how fit and nice and good he looks. And I keep saying this, like men do better with surgery in some ways they don't. Men have thicker skin, more durable skin, better blood supply. The beard gives you more robust blood supply, so men do great, you know, okay? But men are wussies. They don't like acute pain as much. Women are better with pain tolerance.
So it's just not true that a facelift for a man is just going to feminize them?
No.
It's just not true.
No.
It didn't do it to him. He doesn't.
No. It makes him look
cleaned
more
him up
handsome.
for sure.
You know, if you look at handsome men, okay? Let's look at Tom Cruise. Let's look at Brad Pitt. What do those two have in common? A really defined jawline. That is one of the most handsome things that you can do for a man. That guy has a defined jaw.
Today, is the downtime less than it was before?
Yeah.
In the old days?
So, you know, on women, I usually tell them it's 5 days of regret and 2 weeks to the time that they can go to lunch with their friends or go to the supermarket and not feel weird. Okay? Men, it's a little longer because they have bigger heads. Honestly, the whole cranium's bigger. And so with men, and I know men just don't love pain. I tell them it's like a week of regret and 3 weeks before they feel comfortable, because women can cover up with makeup and all this, you know, proud
so men
for
in
2
their
or 3
60s,
weeks.
70s, 80s are doing this.
Yes, and yes. Like here's another guy. This guy's my age. Okay, he's a year younger than me. He's a year younger than me. Okay, I mean he looks significantly older than me. Right? When he came in, and he's a big guy. He looks like a senator. I mean, he's a really handsome guy. But he came in, and I'm thinking, oh yeah, this guy's probably like 70, you know. And then he said, no, I'm 62. I'm like, you are? Wow, you look older, buddy. And so we did his nose. He hated his nose. You know, that's the thing he hated. His dad had the same nose. He hated his nose, and he really hated his neck. He felt like, and he's a very youthful guy. I mean, he's funny,
Yeah.
he's fun, he's cool. You know, some of my patients, I go, God, I love this guy. This guy's like a cool, like I want to go to dinner with him, right? He's a cool guy, right? And he's fun. And so we did a facelift on him and a rhinoplasty. And again, with the neck, recontouring his neck. That isn't pulling hard. And in him, I did a deep plane facelift. That's a deep plane facelift. And you can see how much better, like the whole, not just the neck, but the whole face looks like.
Now, did he come in specifically for his nose, or he came in for possibly a facelift?
He came in for his face, and then we kind of mutually discussed the nose. Sometimes I say...
It made a big difference, especially on the profile.
Handsome guy, right? Look how he's a handsome guy. And, you know, he's now looks younger than his age, and he just looks good, right?
Is this one of those things that they wish they would have done it earlier? Like a few years earlier?
Oh, yeah. Always. Gosh, you know, at the 2-3 week mark, they're like, God, why? They're always asking that. Why did I put this off? Why I look great, you know?
Is it one of those things, you know, like, you know, when you see the, like a Bosley haircut, the guy gets his hair and he's running and hiking and doing all of these things. Is that what it is like for men and women? When they get this new look, do they seem to become more active?
I think Bosley's a marketing genius. Yes, yeah. But yes, that's exactly right. I mean, when you just feel good about yourself and just, you know, taking pictures is a huge thing, or, you know, everybody still does some Zoom and not seeing this big neck hanging out, you know. I mean, I'm in that zone right now where I'm starting to see a little bit. I'm not ready quite yet. I'm putting it off too. But I'll be doing it. I'll be doing it.
It's inevitable. I mean, your neck is going to go out, right?
It's inevitable. It's inevitable.
Take me through the process. So a patient goes to you, a woman, let's say, she's 65 years old. She doesn't like the way she's aging. Jowling, neck, eyes look tired, things like that. What's that consult like? And what are some of the frequently asked questions?
Okay, so, you know, they come in for the consult. I sit them down and I go from the top down and I look at where their brow position is. I see, you know, if I put, and the biggest common mistake is I have extra upper eyelid skin. No, you don't. Your brows are low, right? And then I bring their brows up and their eyelid skin's gone. You know what I mean? So there are brow people, there's upper eyelid people, and there's both. You need brow and upper eyelids. Lower eyelids, you know, I look at the lower eyelids. Look at the cheeks, look at the jawline, look at the neck. If they're thin, I look at the areas for fat transfer. So some people are super hollow in the temporal areas, the lower eyelid junction, nasolabial folds, this jawline. And so fat works really good for those people. So I point out all this, like, you know, I mean, I'm like, hey, my job is pick you apart today. Okay, that's my job. That's my job. And so I look for what's the biggest bang for the buck. You know, what do you need and what do you want? Sometimes we talked about, like, should they do their nose at the same time? Sometimes it's an awesome idea. Sometimes they don't. If you have a cute nose, leave it alone. I'm not into pushing surgery. You know what? I'm in my 4th quarter. I don't need to do surgery. I want to do surgery, and I want to do the best job for that person. And each person's different, and that's the fun of it. That's the challenge of it and the art form.
So what do you say to somebody, maybe they're watching this, they've heard what you have to say, they really don't like the way they're aging, but for whatever reason, they're hesitant. They're scared. What do you say to them?
Come talk to me.
Okay.
See the results. You know, here's the deal. Don't do it before you need to do it. There's this idea of, should I do it before I need it? No. Do it when you need it. Okay.
Okay.
Go to a place that's safe, right? Go to someone who's experienced. Like our office, you know, all facelifts stay overnight, one-on-one with a nurse. Okay?
Okay.
It's important to me. It makes the whole experience better. Keeps their blood pressure down. Nausea control. All those things are important. All my anesthesiologists are 30-plus year veterans. I mean, they're all top guys who come to my office on a regular basis. The team at Scripps Memorial Hospital, there's like 35 or 37 anesthesiologists there. Of that group, I have 7. I want guys at my office who come to my office on a regular basis and do the anesthesia on a regular basis in my office. So they know where there's tube, there's that med, there's the glide scope. They know where everything is because they're there all the time. I don't want somebody who's like, oh, I'm on 6 calls, so I'm going to come over. I haven't been there for 6 months. No. That doesn't happen. And my team, my nurses have all been with me, some for decades, okay? And we have routines. So, you know, you want to make sure that in your surgical center, it's not like you know, football drawing in the sand. You know, if we have a program and everything is spelled out. We have a dedicated recovery room nurse and a dedicated circulating nurse. I mean, when somebody comes out in the recovery, we have one-on-one nurse with that patient. Those are important things. So safety is huge. Safety is number one. Okay. Then you want someone who you like their art form. Do you like my art form? Do you like the way these guys look? Because I can make you look like these guys, right? And so that's important. And so if you like my art form, come on in and then we'll take a look. And I'll tell you what I think. And if what I tell you meshes with what your expectations are, because it's your anatomy, it's what I think, it's what you think, it's an adult conversation. And then when we're done with that, if that's something we'll proceed with, then do it. But I'm not pushing, I'm not forcing you into it.
But back to the skin over the eyes, right?
Yeah.
Upper blepharoplasty, is that what you call it?
That's correct.
But I'm picked up on that most people just need their brows lifted.
Some.
But don't high brows make you look odd?
Well,
like when you look at 18-year-olds, they don't have high brows.
Nancy Pelosi, she looks overdone. I mean, her brows are halfway up her forehead. It doesn't look aesthetically attractive. But that's the art form of this.
So you're just picking up just a little bit.
Yeah, and so everybody is different. Some people have low brows, and some people, you don't know that their brows are low until you have them close their eyes. So part of the exam is they can have like a lot of forehead wrinkles, and they're picking their eyebrows up like this all the time. Then you have them close their eyes, their brows come right down. That's where the mistakes occur, because once you close, that's where their brows live. So whether you need to do a brow, you have to make that assessment whether they need a brow lift or not. And then I put their brows into a position that I think is normal, and then assess, do they have upper eyelid skin? In other words, you can pull the brow up and then you don't have any skin left, but you don't want the brow so high. So you have to decide. That's the art form of doing it. And then, on men, it's rare unless they really need it to, brow uppers and lowers. On men, I usually try to do, 2 of the 3, but not 3 of the 3 at one time. People with dry eyes, I also have to be careful. It's a very common thing. Dry eyes is super common. So when you're messing with eyelids, you've got to be really careful and maybe stage it. So there's a lot of little subtleties that people don't talk about or know.
So if somebody wants to make an appointment, they always get to see you on the consults?
Yeah, they do.
Okay. Do they go to the website or they just call your office? What do you prefer?
Both. Anyway, you can find me on drchasan.com, or Ranch and Coast Plastic Surgery is the practice name.
Okay.
I think you'll probably have my phone number there. But look up my results. You make the decision. You look at it. You see if I'm your artist, and if I am, then give us a call.
Dr. Chasan, we're out of time. Thank you again for coming on the show. Good stuff.
All right. Thanks.
You're watching the Wellness Hour news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.